Okay, let's imagine something pretty scary. Your dog, your absolute best buddy, suddenly just isn't right.
Hmm.
Maybe weak, breathing weirdly, maybe their belly seems swollen or they just collapse. It's awful.
Yeah, really distressing. And those signs, they can be confusing, can't they? Points to something serious, but like what exactly?
Exactly. And sometimes it points towards the heart, or rather the sac around it, a condition called pericardial effusion.
That's the one.
So that's what we're tackling today. This is our deep dive, just for you, using the material you sent over.
Right.
Our job here is to sift through all that info, cut through the complex medical stuff, and really pull out the essentials. What you need to know about canine pericardial effusion.
Like, what is it? Why does it happen? How do vets even find it? And importantly, what can be done?
Think of it as us charting a course for you through this, focusing on the absolute key takeaways from your sources.
Giving you that clear map.
Okay, so first things first. What is pericardial effusion? Let's start there.
Well, at its core, it's simply an abnormal collection of fluid
Yeah.
inside the pericardial sac.
That little bag around the heart?
Exactly. It's this thin, sort of tough pouch. Normally has just a tiny bit of fluid for lubrication, but here we're talking about way too much building up.
Okay. And your sources, they also talk about cardiac tamponade. Is that the same thing or something different?
That's a really crucial distinction your material makes. They're related, but not the same. The
Yeah.
effusion is just the fluid being there.
Right.
Cardiac tamponade. That's the consequence. It's what happens when there's so much fluid that the pressure inside that sac starts to physically squeeze the heart.
Oh, okay. So the fluid buildup causes the tamponade. Tamponade is the emergency part when the heart can't work properly.
You got it. As that fluid increases, the pressure goes up. The sac can only stretch so much, you see.
Makes sense.
And when that pressure inside the sac gets higher than the pressure inside the heart chambers when they're trying to fill with blood, well, that's tamponade. The heart gets constricted, can't fill effectively, can't pump effectively.
And I noticed the sources mention the right side of the heart often gets squeezed first. Why is that?
Yeah, that's a key detail.
Yeah.
The right atrium and right ventricle, they normally operate under lower pressures than the left side chambers.
Okay.
They're also a bit thinner walled, maybe more compliant, so they're just more easily squashed by that external pressure from the fluid. They collapse more easily.
Right, right. So the heart's being squeezed, it can't fill properly, less blood gets pumped out. What does that look like in a dog? What are the signs?
Well, it kind of depends on how fast the fluid builds up. If it happens slowly, gradually,
Okay.
the body tries to compensate. You might see signs that look a lot like right-sided heart failure. Fluid backing up into the abdomen, for instance.
Making the belly look big and swollen.
Exactly. That abdominal distension the sources mentioned. Or you might see the jugular veins in the neck bulging because the blood's backing up.
Gotcha. But what if it happens fast?
Yeah, if it's rapid, the body has no time to adjust. That's when you get those really dramatic, acute signs you described at the start.
The sudden weakness,
Yes.
collapse.
Yes. Because the blood output from the heart just plummets suddenly. Not enough blood getting to the brain, the muscles. It's a cardiovascular collapse, really.
So it hits the heart and circulation hard.
Yeah.
But your sources also hinted it affects other parts of the body too.
Oh, definitely. I mean, everything relies on good blood flow, right?
Right.
So if the heart isn't pumping well and blood is backing up, the liver can get congested.
Which might show up on blood tests?
Could do, yeah. You might see elevated liver enzymes. The kidneys can be affected too if their blood supply drops. Waste products might build up.
Okay.
And sometimes you see respiratory signs like fast breathing, maybe even fluid building up around the lungs themselves. That's pleural effusion, different from the pericardial effusion, but it can happen too.
Wow. Okay, so that explains why the symptoms can seem so varied. It's not just one thing. So
Yeah.
what actually causes this fluid buildup? Why does it happen?
This is probably one of the most challenging aspects highlighted in your material. Sheer number of potential causes is huge. Yeah. And interestingly, some breeds seem to pop up more often. Golden retrievers, German shepherds. They're mentioned as being more prone to certain heart cancers, like hemangiosarcoma.
Oh, wow.
And also to cases where, frankly, we don't find a cause. That's called idiopathic effusion.
Idiopathic.
Yeah.
Meaning we don't know why.
Pretty much.
Yeah.
After all the tests, no clear reason is found. Often involves inflammation, maybe some scarring of the sac itself.
And you mentioned cancer, hemangiosarcoma. Are there others?
Oh, yes. Cancer or neoplasia is unfortunately a really common reason, according to your sources. Hemangiosarcoma is a big one, especially in the right atrium, but also tumors at the base of the heart, like chemonectomas or aortic body tumors, Boxers and other flat-faced breeds get mentioned there.
Okay.
Then there's mesothelioma, which is cancer of the lining of body cavities, or cancer that's spread from somewhere else, metastases, lymphoma too. Yeah, cancer is a major player.
Gosh. What else besides cancer and the idiopathic kind?
Well, the list goes on. Problems with blood clotting are mentioned, like if a dog unfortunately gets into anticoagulant rat poison.
Oh, no.
Yeah. Sometimes, though less common in dogs than cats apparently, it can happen secondary to congestive heart failure. Infections are possible, causes two fungal infections in certain areas, or bacterial infections.
Lung infections. Okay.
Even things the dog is born with, congenital issues,
Hmm.
like a defect allowing abdominal contents near the heart, or rarely a tear in the heart chamber itself.
Mm.
Or even, get this, a foreign object somehow migrating into the sac.
A foreign. Wow. Okay. So, from aggressive cancers to infections to rat poison, that is a lot of different paths to the same endpoint. How on earth do you figure out which one it is?
That's the million-dollar question, isn't it? That's the diagnostic challenge. A vet will get clues from the physical exam,
Like those swollen neck veins you mentioned, or muffled heart sounds.
Exactly, because the fluid blocks the sound.
Mm.
But your sources are pretty clear. You need more specific testing to really know what's going on.
Blood tests.
Blood tests are usually run, yeah. Standard stuff, CBC, biochemistry panel. But interestingly, the sources point out they can look surprisingly normal, even with a lot of fluid.
Really?
Yeah, they might show anemia if there's active bleeding into the sacs, maybe hint at liver issues if it's chronic, but they don't usually pinpoint the cause of the effusion itself.
Okay.
Checking clotting times, though. Yeah, it's crucial if there's any suspicion of poisoning. Absolutely vital.
So blood tests help assess the overall picture, but they aren't the main diagnostic for the cause of the fluid.
Generally not for the primary cause, no. Your sources really hammer this home. The single most important tool is echocardiography.
The heart ultrasound.
Exactly. That's how you get eyes on the situation. You can see the fluid, estimate how much is there. You can look for those masses we talked about on the heart muscle or at the base.
So you can actually see a tumor.
Often you can see a mass, yes.
Mm.
Now, the sources do caution that echo can't always tell you exactly what kind of tumor it is just by looking. But seeing a mass there, that's a huge finding. And critically, the echo can directly show the signs of tamponade. You can see the heart walls, especially the right side, collapsing inwards when they should be filling.
Wow. So it confirms the fluid and looks for the cause and sees the immediate danger.
Pretty much. Chest x-rays can help too. They might show a big, round-looking heart shadow like a globe or fluid elsewhere in the chest. But the echo gives that crucial detail of the heart in the sac itself.
Okay. So let's say you've done the echo, you see the fluid, maybe you even see signs of tamponade. What's the first thing you do? What's the priority?
If tamponade is happening, if that heart is being squeezed, the sources are unanimous. Immediate pericardiocentesis.
That's draining the fluid.
Yes. Sticking a needle or a catheter carefully into the pericardial sac and drawing off that excess fluid, it's often life-saving.
Because it relieves the pressure instantly.
Instantly. The heart can suddenly fill again, pump properly again. It buys critical time and makes the dog feel dramatically better, usually very quickly.
Is that a risky procedure?
It needs to be done carefully by someone experienced, absolutely. There are risks, like hitting the heart muscle or a major blood vessel. Your sources mention it's usually done from the right side in the chest to avoid certain vessels, often guided by ECG to watch the heart rhythm.
Okay.
The goal is just to get as much fluid out as safely possible to relieve that pressure.
What about just using drugs? Can't you give medication to get rid of the fluid?
That's another key point from the material. Generally, no, not for tamponade. Medications aren't a substitute for physically removing the fluid when the heart's being squeezed.
Okay.
In fact, some drugs often used for other types of heart failure, like diuretics to make the dog pee out fluid, are often contraindicated. They're discouraged with tamponade or chronic effusion.
Yeah.
They can lower blood pressure further and make things worse.
Right. So meds aren't for the effusion itself, but maybe for the cause.
Exactly. Once you have an idea of the underlying cause, then medications come into play. Vitamin K if it was rat poison, antibiotics or antifungals for infection, maybe chemotherapy for certain cancers like lymphoma or even hemangiosarcoma, though the success rates vary a lot.
Okay. And surgery. Is that ever an option?
Yes, surgery definitely has a role, particularly if the effusion keeps coming back despite drainage, or for specific tumor types.
Like removing the sac?
Precisely. Removing part or all of the pericardial sac, a procedure called pericardiectomy. This can be really helpful, especially for those idiopathic cases where you don't find a cause, but the fluid keeps recurring, or for some of those slow-growing heart-based tumors.
So the fluid just doesn't get trapped anymore.
Right. It can still be produced, potentially, but it can drain into the chest cavity instead of getting trapped and causing tamponade. Your sources mention less invasive, like keyhole surgery options are sometimes possible too. It can manage the chronic fluid issue and potentially improve survival time, depending on why it was happening.
Okay, that makes sense.
But here's a really critical point that your sources emphasize over and over. These effusions, they typically come back.
Ah, so draining it isn't usually a permanent fix?
Rarely. Pericardiocentesis is often a temporary measure. It stabilizes the dog, makes them feel better, buys time for diagnosis. But you have to expect the fluid will likely reaccumulate.
So managing this is often a long-term thing. You have to keep checking.
Absolutely. Regular checkups, repeat ultrasounds are often recommended to watch for recurrence, even if you think it was idiopathic.
Okay.
And this leads directly to what might be the single most important takeaway from all the material you provided: the prognosis, the dog's long-term outlook. It is overwhelmingly dictated by the underlying cause of the effusion.
How much difference does the cause make? Is it significant?
It's night and day, honestly.
Yeah.
The sources paint a very stark picture here. For that cancer we mentioned, hemangiosarcoma on the right atrium, the prognosis is typically poor. It's very aggressive.
Even with treatment?
Even with surgery to remove the sac and chemotherapy. Survival times are often measured in months, sometimes just weeks or a few months. It's tough.
Gosh, okay. What about other causes?
Well, contrast that with, say, one of those heart-based tumors, like a chemodectoma. These tend to grow much more slowly and spread late, if at all.
So better outlook.
Much fairer, yes. They might still cause recurrent effusions, but surgically removing the pericardial sac can often resolve the clinical signs from the fluid itself, and dogs might live for several years with good quality of life, just managing the tumor's slow growth.
Wow, years versus months. That's huge. What about the idiopathic cases, the ones where you don't find a cause?
Those are sort of in the middle, but generally have a better outlook than the aggressive cancers. They also do recur, requiring repeated drainage or potentially that pericardiectomy surgery. But many dogs can be managed reasonably well for a decent period.
So a dog collapsing from this could, theoretically, have just months left, or potentially years of good life ahead, and it all hinges on why the fluid is there in the first place.
That's exactly it. The fluid causes the immediate crisis, the symptoms you see. But the diagnosis behind the fluid tells the real story of the disease and what the future likely holds.
Well, it really underlines why trying to find that cause is so vital, even when things seem urgent.
It really does. Owners need to be prepared for that possibility of recurrence and understand these widely different potential outcomes based on the cause.
Okay, let's try and summarize this deep dive then. We've pulled apart the difference between just having fluid there, the effusion, and the emergency squeeze, the tamponade.
And we've seen the massive range of potential causes: nasty cancers, yes, but also infections, clotting issues, idiopathic inflammation. Quite the list.
We looked at the signs, how they can be sudden and scary or more gradual, and why that heart ultrasound, the echo, is so incredibly important for diagnosis. Not just seeing the fluid, but hunting for that cause.
Right. And we touched on treatment draining the fluid, pericardiocentesis, being absolutely key for tamponade stabilization.
While remembering that medications are more for the underlying cause, and surgery can be an option for recurrent fluid or specific tumors.
And always keeping in mind that key point. The fluid usually comes back. Management is often ongoing.
Which circles back to maybe the biggest takeaway from your sources, that dramatic difference in prognosis. It all comes down to the why. Poor for aggressive cancers like hemangiosarcoma, fair to good for things like chemodectomas or idiopathic cases, managed well.
Understanding that huge variability really helps you grasp the challenge vets face and why they push for diagnostics to find that cause. Even in a crisis, it changes everything.
Which kind of leaves us and you with this final thought, really emerging from the complexity in the material.
Yeah, given how incredibly different the prognosis is based on that underlying cause, and knowing that finding that cause definitively can sometimes be really difficult, maybe even impossible.
Right.
How does that inherent uncertainty shape the way vets approach the initial diagnostic workup? And maybe more importantly, how does it influence those crucial conversations with owners about long-term care, expectations, and making decisions?
It really highlights that it's so far from a one-size-fits-all situation, doesn't it? When you know some causes are just so much harder to treat effectively than others, how does that knowledge impact how far you go with diagnostics and what kind of long-term plan feels right for that specific dog and owner?
That's the fundamental challenge right there. A really difficult aspect of managing these cases.